A lot of my patients ask me, what should they be doing if they are thinking about trying to get pregnant within the next year or so? So, one thing that I like to talk to my patients about is something called genetic carrier screening. Genetic carrier screening is an optional genetic test that you can do either in pregnancy or before pregnancy. And basically, what it is a blood test looking at your genes, and it checks for 176 rare genetic conditions to see if you're a carrier for any of these conditions. If you're a carrier for one of these conditions, you wouldn't know about it, wouldn't affect you in any way. Usually it's not in your family history at all. But if you and your partner both happen to be carriers for the same condition, then a pregnancy could be affected. So this is a blood test that you can do. Your partner could do as well. Sometimes we'll only test one person, and then if they come back negative for everything, then there's no reason that we would need to test the partner. But it's pretty common for people to come back as a carrier for something just because we check for so many different conditions. And then in that case, we would check the partner for just that same condition just to make sure that they aren't carriers for the same condition. If they happen to both be carriers for the same condition, then we would refer them to genetic counseling and talk more about that. Usually what that would mean is that a pregnancy would have a 25% chance of being affected by that condition. So if that were the case, which is pretty uncommon because all of these traits are rare in the population, but if that would be the case, then the couple would have the option to potentially do IVF and then select an embryo that is not affected by that condition. So this testing is optional for everyone, available for everyone, but it is especially recommended for certain ethnic groups. People of Ashkenazi Jewish descent are at increased risk of being carriers for these types of conditions. And there's some other groups, ethnic groups, or if the patient and partner are both from similar ethnic background, maybe a little bit more likely that they would both be carriers for the same thing. So it's just something that people can do if they are thinking about starting a family, something that they can do in advance just to get checked and just make sure that there's no reason that they would need to think about doing IVF for building their family.